All right, well, another death has been reported in the state last week from flu-related complications. Over 2,000 flu-related deaths have been reported around the country, 5 of them now in Connecticut. The flu is widespread in the state, but it's not too late to get a flu shot and protect yourself from the virus. And joining me in the studio this morning to discuss just how you can protect yourself is Dr. Virginia Bieluch, Chief of Infectious Diseases at the Hospital of Central Connecticut. Dr. Bieluch, good morning. Thanks for being here.
Good morning to you, too.
So you've been very busy. We've been talking over the past couple of days. Tell me, let's just start with, how is this flu season compared to in years past? Is it more difficult?
Well, currently flu activity is widespread. The numbers of cases are continuing to increase throughout the country. It's hard to know when we will plateau. Will things get worse? The one thing we know about the flu is it's unpredictable. But yes, we are seeing a lot of hospitalizations, a lot of outpatient illness with influenza.
Someone sitting on the couch right now, maybe they haven't gotten the flu shot yet. Is it too late in the season to do that?
It is not too late to get the influenza vaccination. I think we're still facing weeks and weeks of illness.
Can you still, and you can still get the flu even if you do get a shot, right? It's not 100% effective.
Yeah, there's no vaccination that's 100% effective. And yes, you can still get the flu if you get the flu shot. If you get the flu after getting the flu shot, though, it's usually not going to be as severe a disease as if you hadn't received your influenza vaccination.
And there is a myth that we always like to dispel with this story. The flu shot cannot give you the flu. That's correct, right?
The flu shot cannot give you the flu.
And talk a little bit about why that is.
Well, most of the influenza vaccinations are not live viruses. They are parts of viruses, usually, that cannot produce illness in humans.
If someone doesn't like a needle, too, we've come a long way, right? I mean, there's different types of flu shots you can get.
There is a live virus that can be given through an intranasal spray. It's only recommended for younger individuals who have no other medical problems. But in certain populations, yes, you can avoid an injection.
Let's talk about the different populations. When it comes to the flu virus, who is most at risk?
Well, we're most concerned about the young. Pregnant women can get severe influenza. Older individuals can get more severe disease. And anybody with underlying heart disease, lung disease, anyone whose immune system is not working up to par is at risk of getting a more severe influenza-like illness.
And if someone already has the flu or they believe that they have symptoms, is there anything that they can do now?
Early on in influenza, if you start taking an antiviral medication, you can shorten the duration of your disease, possibly prevent complications. So it's important to speak with your health care provider. If you're really sick, seek health care in an emergency room or urgent care center.
Dr. Bieluch, what is the best thing to do to prevent the spread of the virus altogether?
If you have influenza, stay home. Don't expose other people to your illness. When you cough, when you talk, when you sneeze, you can spread virus up to 6 feet away. So we always say cover your cough. And if you're not sick, stay away from people who are sick. And sanitize your hands, because rarely the virus can get on your hands and then get into your body through your mouth or rubbing your eyes or touching your nose.
And last question for you. We heard a lot last flu season about the flu shot not being very effective. That's a different case this year. Is that true?
Well, I haven't heard that it isn't effective. I actually haven't heard the statistics yet thus far. It's a little early in the season to know for sure.
And we're peaking, or do we not know that yet?
Don't know if we've peaked yet. We are at levels comparable to peaks in other years. Whether this will start to level off or taper off, we just don't know yet.
Dr. Virginia Bieluch of the Hospital of Central Connecticut, thanks so much for joining us this morning. We appreciate your time. Time now to get